Oral health is important because it's like a mirror to your general health. Patients who have HIV, they have something known as linear gingival erythema. So it's like, just the scallop of the gums, the margin, that's like, very prominently red in color.
But just to understand, what are the early signs of dental issues that people will often overlook?
The second time, if you're brushing at night, you don't need to wake up every morning and how we are in the habit of brushing. You should brush after your breakfast. But most patients, what we see is, they just go scrub. They go horizontal scrubbing.
What about these whitening toothpaste? Do they really make your teeth white?
So I'm not a big fan of the whitening toothpaste.
Dr. Kanupriya, welcome to Infinite Health. Thank you so much for coming.
Thank you for having me.
Dr. Kanupriya, this podcast is like a template for all the people who are watching who have so many questions on oral healthcare routines and are very confused because there's too much of literature out there and it gets very confusing for any person. So we want to have a discussion which will set the template straight. For oral care routines that people should follow. But just to begin with, why is oral healthcare important for overall health?
Oral health is important because it's like a mirror to your general health. There are so many diseases that we can diagnose just by looking at your oral health. So many diseases that go unnoticed. You might have diabetes. You might not show any other signs, but your dentist can see your gum health and tell you that you have diabetes. Even HIV patients, they might not know they have HIV. Looking at their gum, we can tell them that it's an HIV, patient. So there are lots of systemic diseases that have oral manifestations which don't show symptoms otherwise. And oral health, we say, is like I just said, it's a mirror to your general health. And it starts from your oral cavity, right? The food goes through your oral cavity. That's where the nutrition goes in from. All the bacteria in the oral cavity, they can affect your heart. Everybody knows that, heart disease and periodontal disease is very closely connected. So it's basically a mirror to your general health.
So, you just said that you can actually identify a person who has diabetes or who has HIV by looking at their gums. How does that work?
So, very interestingly, patients who have HIV, they have something known as linear gingival erythema. So it's like, just the scallop of the gums, the margin, that's like, very prominently red in color, which is a classic sign of a patient having HIV. So when you see that, you immediately ask the patient to, if they don't know that, they are not on medication and they don't know that they're HIV positive, to get the blood test done. Again, in case of diabetes, patients might have good oral hygiene. In spite of that, they might have bleeding gums, soggy gums, inflamed gums. So, you can have gum issues when you have bad hygiene, obviously. But in spite of having good hygiene, sometimes patients present to us with these problems. So that is when, we get their HB1 AC done and, checked and things like that. Yeah.
That's very interesting because when I was a very, very fat kid, I always had bleeding gums. Could it also detect sort of insulin resistance maybe?
So, not insulin resistance, but once we know the diabetes, it could be because of insulin resistance, it could be type 1, type 2, whatever that might be. But the point is that, the diabetes part of it can get also patients who have diabetes have high caries index also.
Right.
You have high caries index plus you have gum diseases. So that's it goes hand in hand with diabetes.
That's very interesting because Fortunately, I'm not diabetic yet, but I used to have really bleeding gums when I was really fat.
So that's probably because you did not maintain your oral hygiene when you were a kid. Because obviously if you're saying that, you were a fat kid who was fond of eating, but not rinsing your mouth after eating every time, not rinsing after snacking or having a drink. So, it just builds up on the plaque, which causes bleeding gums.
Right. But just to understand, what are the early signs of dental issues that people will often overlook until it's too late?
Sensitivity. People will overlook sensitivity, bleeding gums. The minute you see bleeding gums, most of my patients, my gums have been bleeding, so I've avoided that area. They don't brush that area because it's going to bleed. Now, what that in turn does is, it gets worse. Because it's bleeding, it's your sign that you need to visit your dentist. You need to get that addressed. You need to get that area cleaned. Even if you don't go to the dentist, you have to floss and brush that area even more. than the other parts which is bleeding more, because it's inflamed. There's a problem over there. You can't avoid it. You can't avoid brushing that area, because if you do that, you're only increasing the disease over there.
Right.
Yeah.
Then, I mean, is that in some way related to bad breath? Like, why do some people have bad breath?
Bad breath has 3 reasons. Number 1 being bad oral hygiene. Number 2 being your poor gut health. And number 3, if you're a mouth breather. So if you're a mouth breather, or if you have dry mouth, if you don't have enough saliva in your mouth, that leads to bad breath.
Right.
Yeah.
So, like, we spoke about the basic problems, like not going too much into diseases right now, since we're talking about a general oral care routine. I mean, I just really want to jump into brushing. Why is it important to brush your teeth?
So brushing the teeth is mainly to remove the plaque from your teeth.
Okay.
Now, our saliva contains proteins, and they get deposited onto the tooth surface. Whatever you're eating, that gets mixed with saliva. It forms a pasty, layer that gets stuck onto your tooth surface. Now, that over time, if not cleaned, properly every day, it tends to harden. Once it becomes hard, there is no way you can remove it. Then you have to visit your dentist to get rid of it.
And can that go inside your gums?
It does. So the plaque, the gum is resting onto the tooth surface. There is a 2 millimeter gap where food, plaque can slide between. It's like like just a little opening where it's on your tooth, but there is a very small gap. Now, if the plaque is long standing, it starts penetrating deeper and deeper between your gum and the teeth, creating a deeper pocket. Right. Once the attachment between the gum and the tooth is lost, that's when your teeth begin to move. It starts shaking. Once your teeth starts shaking, it's too late.
Because the reason I asked this is because I remember, like, a few years back, I had gone for my teeth cleaning after a very long time, probably 1.5 years. And at that point of time, my oral health care was like, somewhere okay. Like, I used to brush 2 times a day and all that was fine. But when they cleaned my teeth with, like, professionally, when they cleaned my teeth, like, I literally had bleeding gums and, like, those hard white things, like the pasty stuff that you're talking, calculus, coming out. And I was so shocked that time. And, like, it was like, what happened to my, and that is when I started becoming so obsessed with oral health care. But nevertheless, then what would you say is the correct way to brush?
So most patients brush in a horizontal direction. You have to brush vertically. So I can show you how to brush.
Right.
Yeah, so the correct way of brushing is, you hold your brush at a 45-degree angle, and the brush has to go right from the gum margin to the entire length of the teeth. So you hold the brush like that, give slight vibratory motions, press it against the gum and the teeth, and then take your bristles down. That's the way you have to brush your teeth. Slight vibratory motions, press it, pull your brush down. Similarly, for the bottom teeth, you give slight vibratory motions, pull it up. Slight vibratory motions, pull it up. So, but most patients, what we see is, they just go scrub. They go horizontal scrubbing. In that case, what happens is all these areas which are close to the gum, they start abrading because of aggressive tooth brushing, and your sensitivity starts. So correct brushing is very important. Similarly, you have to brush the insides of the teeth. See, I'm holding the brush vertically and I'm taking it like that. For the upper front teeth, like that. Because you have to brush the insides. It's only the biting surfaces where you can take the brush horizontal and go scrub. It's only on the biting surface. Nowhere else will you take the brush and scrub it in the horizontal direction. And you could also use the circular motion. So this is how you are supposed to brush your teeth.
That's fab, like, because this is the first time I'm actually getting a real visual representation of how you should brush your teeth. But then, just like, is there a correct time to brush your teeth, or just like after every meal?
No, you don't have to brush so many times. You ideally should brush at night, which is most important. The second time, if you're brushing at night, you don't need to wake up every morning and how we are in the habit of brushing. You should brush after your breakfast. But not again immediately after your breakfast, because when you've just had your meals, there is an acidic environment in your mouth. And if you are brushing immediately after breakfast, you might take away your, enamel. So you have to wait for at least 20 to 30 minutes post breakfast is when you should.
That's interesting. Like, so you have to wait after breakfast, because people would have a habit of have breakfast, and go brush, immediately brush.
No. So immediately after breakfast, your mouth is still acidic. So if your mouth is acidic, it's in the demineralizing stage. So in that case, if you are brushing, you tend to take away the enamel more. So you have to wait for the environment to kind of settle down and then you brush.
And is there a time to it? Like does the timing of how long are we brushing for affect our oral health in any way?
So the ideal brushing time is 2 minutes. Now we tell all our patients that you play on your favorite music, whichever song is approximately 2 minutes long, play that on, and then you brush to it. Because when we are brushing, you see any study data, you don't brush more than 15 to 20 seconds. And those 15 to 20 seconds seem like 5 minutes to us. So that is why you have to time your brushing, because when you're brushing so quickly in 15 to 20 seconds, you're not doing a good job. And some patients go overzealous, like they just keep on and on brushing. That again is not good, because then you're taking away your enamel, you're doing more harm than good. So it's important to kind of stick to the timelines.
I know this is funny, but I feel like I'm trying to impress you as my teacher, and I actually put on a song and brush at night, because I had a habit of 15 to 20 seconds.
Yeah, because that's what most patients. So we tell them that please put on your favorite music, because putting on a stopwatch doesn't really help. Right. So it's better you brush to music, and that kind of works.
But something that I've always wondered, like electric toothbrushes or manual toothbrushes, which one is better?
Very frankly, both are absolutely okay. It depends on the patient, because if the patient is lazy, if the patient doesn't have good motor movements, if it's a child who's struggling to brush, or an adult or an autistic, a patient who's doesn't have good muscle movements, then yes, we will want to recommend an electric brush. But if a patient has good dexterity, a manual brush does the job equally well.
Because there's so many toothbrush options available, like it's so difficult to choose one. Like if you had to choose one in India, which one would you choose?
Personally, I don't know if it's okay to give out brand names over here.
No, that's absolutely
fine. So
I
am personally using Curaprox. So that's the brush I use. And you could use any soft brush basically, because we don't want you to use a medium or a hard brush, because that just tends to take away your enamel more.
I'm so happy I use Curaprox too. But then, how often should you replace your toothbrush?
3 months.
3 months, yes. Right? 90 days. Perfect. But then, we spoke about toothbrushing so much, I think we really need to address toothpaste also. What makes a perfect toothpaste, and what will be the top, say, 2 or 3 recommendations for toothpaste that you would have?
So see, your toothpaste must contain fluoride, 1000 ppm of available fluoride. It should contain nanohydroxyapatite, because what happens is there's always an ion exchange going on between the oral environment, between the teeth and the saliva, and there's an calcium ion exchange. Now when you have nanohydroxyapatite in your toothpaste, it's just easily available to your tooth structure. There's easy exchange of the calcium ions. Similarly, fluoride is something which reinforces your tooth, helps your tooth in fighting against the cavity causing bacteria, helps with the sensitivity also. So these are the 2 top products that the elements that you have to see whether your toothpaste contains, which is nanohydroxyapatite and fluoride. If your toothpaste contains these 2 things, you are good. We don't want any of the fancy things in your toothpaste, like namak hai, kala namak hai, charcoal. We don't want anything of that. We just want fluoride. We want nanohydroxyapatite. We don't want anything else. It can contain all the other things. We don't care. But these are the main components they should have.
Right. Any recommended brand that you feel have these 2 components?
BU. Again,
BU?
Yeah, it's okay. The brand is called BU. Again, not promoting any brands over here.
No, that's okay. We have no affiliations with any brands anyway.
Yeah. So, not this thing, but it's again, that is something which has both of these.
Like fluoride and
nanohydroxy.
BU.
BU.
Like BEU or BU?
BEYOU.
Okay, BU.
Be yourself.
Okay. But
BU.
what about Curaprox as well?
So that is by Curaprox.
Oh, acha, that's by Curaprox.
Yes.
Okay.
Yes.
Those colored multi-tubes.
Yes.
Right. Very expensive though. But what about a average day-to-day brand? Do you feel something fits the bill? Perfora has, I think, these elements.
Yeah, so I really haven't seen the Perfora toothpaste, but I'm sure, there are so many. You can just go online and, search whichever toothpaste, and all of them have the ingredients listed. You just have to see for these ingredients. Even Colgate Total is very fine. It also contains SLS, and nowadays, everybody wants to go SLS free and things like that. But even Colgate Total is very good, yeah.
Okay, these are the good toothpaste you should use. But what about these whitening toothpaste? Do they really make your teeth white?
So I'm not a big fan of the whitening toothpaste, because they contain a higher abrasive particle. So initially your teeth might seem that, they are whiter, brighter. But in the long term, they make your teeth very sensitive, because they have higher abrasive particles.
But what if we set a protocol for that? I'm just thinking out loud. Like, what if I say that I'll use it, say, maybe for 2 days before an event and then use it after a month?
No, so see, basically, if you want whiter teeth, just go to your dentist, get your teeth whitening done. Once you have your teeth whitening in order, you can just go for touch ups, and then you can maintain white teeth for life. It's not like, there's this common thing going on that, once I whiten my teeth will come back to yellow. It's like maintenance. Teeth whitening, firstly, is an aesthetic procedure. It's not a mandatory procedure that you have to do. It's a purely cosmetic procedure. So if you are getting teeth whitening done, just like any cosmetic procedure, you would have to have touch-ups, you would have to have maintenance. So once you've done your teeth whitening, if you don't maintain it, your teeth will go back to the same, it will come back to the yellowness. But if you are maintaining it, you can actually maintain white teeth for life. So if you are somebody who wants white teeth, get your teeth whitening done at your dental office and then just do the regular maintenance and you can maintain white teeth. You don't have to resort to whitening toothpaste.
So the teeth whitening in the dental clinic does not have that abrasive chemical?
It doesn't have the abrasive thing. It oxidizes your teeth.
Okay.
It oxidizes
so that's further helpful.
Yes, it oxidizes the pigments in your teeth.
But just coming back to the oral care routine that we were talking about, like, we spoke about toothpaste, we spoke about toothbrush and the way to brush your teeth. What about tongue cleaning?
Tongue is a self-cleansing organ. Okay. So tongue cleaning, although it's very popular, it's not really something that everybody needs to do because tongue can pretty much, clean itself. But if you do feel that, your tongue gets coated a lot, then, once in a while you can obviously do tongue cleaning, but it is not something that you do every day. You don't really need to do tongue cleaning, tongue scraping every day.
But just as a general advice, like if you had to make, say, a general protocol for the people who are watching this, like, would you just say that on an ad hoc basis, maybe once a week is fine?
Yeah, like once a week, once in 2 weeks is okay.
Right.
Yeah.
Like they can use a gentle brush to clean the tongue.
Yeah. I mean, you don't need a tongue scraper. You can just brush your tongue with the regular toothbrush. You don't have to have a separate tongue scraper.
But then would you put toothpaste on it?
You can for the, because sometimes
for the cleansing effect.
For the cleansing effect, you can.
Okay.
Yeah.
Now, the next point that I wanted to talk about was mouthwash. Like, is mouthwash necessary, especially those alcohol ones, Listerine?
So alcohol ones are definitely not recommended. None of the mouthwashes with alcohol are recommended unless you are somebody who has been prescribed by your dentist because of other dental issues. You've been prescribed a mouthwash, then yes. But on a day-to-day basis, nobody needs to use a mouthwash. If you are maintaining your oral hygiene correctly, and by that I mean brushing and flossing. So if you are doing these two every single day, you do not need to use a mouthwash. It is not required.
I know flossing is very important, but like there's so many people who think that flossing causes gaps in between their teeth.
So, that's a myth because flosses are waxed and you have to use it every day. It does not create gaps between your teeth. Now, when you have food stuck between the teeth or you have plaque, and when you remove that plaque and you see that little tiny hole in there, it seems that, oh my God, the space is created. But the space was already there. It was just filled up with the plaque and you saw that white layer. You did not realize that there's a gap over there. But flossing will not create gaps. Flossing is important because if you're not flossing, you're actually missing out on 33% of your teeth that you're not cleaning. So flossing is very, very important.
But would you recommend those string flosses or the water floss?
So again, I love the thread flossers. They do a fab job, but it's very cumbersome to do it. And the patients feel very lazy to do it. It's very tedious. So rather than not doing it, water flossers are great alternatives. But you should always have the hang of using the thread flosser also because we don't want you to be completely dependent on the water flosser. What if the batteries died? What if the charger's not there? You're traveling, you've forgotten to carry it. Thread flossers are very easily available. And plus it does the job very, very well. So we want you to get the hang of using a thread flosser and use that. Maybe you could alternate between a water flosser and a thread flosser, but keep a habit of using both.
No, we just spoke about in length about like, the kind of routines that we need to practice. But what about cavities? Like, how do they happen in the first place?
So cavities are basically when your teeth begin to demineralize because of the acidic environment. And that's when, you start feeling, you see these black spots on the teeth. You start feeling sensitive over there. The food starts getting stuck over there. So that is basically what a cavity is. Now, a cavity may not cause sensitivity, may not cause pain, and you might overlook it. That is why it's very important to get a regular dental checkup done to spot those early cavities and get them filled. A cavity, you cannot heal a cavity with toothpaste, toothbrush, floss, all that we've discussed. You can't heal a cavity by maintaining a good protocol. If you maintain a good protocol, cavities will not come. But in spite of that, if a cavity has come, now we have to take care of it. We have to physically get rid of the cavity and do a filling over there. So that is what needs to be done when you have a cavity.
Right. And are there any simple ways to prevent cavities?
So if you're following a good protocol, if you're rinsing your mouth after every meal, if you are brushing and flossing regularly, you should not be getting cavities.
But then what's root canal? Because so many people get the root canals done.
So when the cavity reaches the pulp, the tooth has 3 layers, the enamel, dentine and pulp. So if the cavity has not been filled in the initial stage when it is still in the enamel and dentine, and it reaches the pulp, so which is the innervation part of the tooth structure, the soft part of the tooth structure, when the cavity reaches the pulp, that's when you need a root canal treatment.
Okay. And is there any signs and symptoms which leads me to believe that I need a root canal?
So when the cavity reaches the pulp, you will have a lot of pain. In some cases, if the tooth becomes dead and there might not be any pain, but in majority of the cases, when the pain begins is your sign, your cue that it needs a root canal treatment.
So what do you exactly do in a root canal when you detect someone with a root?
So in a root canal procedure, what is done is the pulp, the soft part of the tooth is completely removed. It's completely cleaned out. It's disinfected. The tooth is completely disinfected. And then an artificial material is put inside the tooth to seal off that area. Once that is done, because the root canal has now lost all its water supply, all the blood supply, it tends to become a little brittle. It tends to break in future. So to prevent any further damages to the tooth, to prevent any further breakage to the tooth, we want to either give you an onlay on the tooth or a crown to prevent it from breaking, because now the tooth is essentially brittle. It's not hydrated anymore. Yeah.
But then after the root canal is done, then how do I take care of that specific area, that specific?
So you just maintain it like a regular tooth with brushing and flossing, and your dentist would have given you an onlay or a crown over it to prevent breakages. So you treat it like a normal tooth basically. There's no special aftercare for a root canal treated tooth per se.
So then what should I do if I experience pain even after root canal is done?
So immediately after treatment, you might have pain for a couple of days because the treatment has just been done and that area is a little tender. But over a period of time, that pain kind of eases out and then you just treat it like a normal tooth. Very rarely do root canal treated teeth get reinfected. If there is some latent bacteria which remained in the tooth and it again after a few years, if it gets activated or some secondary infection in the tooth, but those are very rare. It's very rare that a root canal treated tooth again needs retreatment. But if at all that does happen, then you have to undergo a retreatment for the root canal.
But are gum infections common in general, like gum diseases?
Yeah, gum diseases are very, very common. Very common. Because if you're not maintaining your oral hygiene, bleeding gums is the first sign of, gum disease.
Right. But Dr. Kanupriya, just to summarize this as a template for all our viewers who listen, we spoke intensely about, all kinds of oral healthcare protocols. But if you had to summarize, just to close this entire discussion, what would be your top 4-5 ways in which a person needs to take care of their oral health?
So firstly, brushing twice. Brushing at night is more important than brushing in the morning. Like we said, brushing after breakfast, like 20 to 30 minutes after breakfast. Flossing is like the gold standard. You cannot do without flossing because flossing has to be a part of your daily regime. Not that I'm flossing once a week. Flossing has to be done every day. Flossing before brushing. Most people floss after brushing. So when you're flossing before brushing, you make the plaque loose between the teeth and then you just brush it off. Right? So flossing, brushing, and then you could add a warm saltwater rinse because salt water helps with the gum health. So if you're brushing twice a day, if you're flossing every day, do a warm saltwater rinse. Another thing which is very important is rinsing after every meal. The earlier, we would never go out of the house without rinsing your mouth as per the Indian culture. That is because meetha muh nahi rehte, kuch bhi kha ke you have to rinse your mouth. And nowadays with all of us living such busy lives, we are eating, we are not rinsing. So that is another major problem. So don't forget to rinse your mouth.
Those are some pro tips, guys. For all of you who've seen this podcast, I assure you, like, if you follow these specific tips that Dr. Kanupriya just mentioned, I think you will save yourself from a lot of diseases and a lot of body pain.
Absolutely.
Dr. Kanupriya, thank you so much for doing this with us. It's been an absolute pleasure.
My pleasure as well. Thank you.